Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCrae.
As healthcare costs keep going up, and boy, are they going up, patients, providers, insurance companies, and employers they're all looking for ways to avoid unnecessary medical tests and procedures. In other words, they're trying to reduce the cost of medical care. We all want to do that.
Sure.
Now, the American Board of Internal Medicine has come out with a new recommendation called Choosing Wisely. They now advise that if you're healthy and you don't have any symptoms, you don't need a routine medical exam, a routine physical exam, which is heresy, isn't it?
Oh, well, on the other hand, significant numbers of patients continue to feel that they should have some sort of regular checkup or visit with their doctor. So who needs an annual exam and who doesn't? Here to share information from his workshop, An Ounce of Prevention is a Ton of Work, Rethinking the Annual Exam, what a great name, is Mayo Clinic family medicine physician Dr. John Wilkinson. Welcome back to the program, Dr. Wilkinson. It's good to see you.
Thank you very much. I'm glad to be here.
Dr. Wilkinson, it is so good to see you and hear you talk about this topic. And I guess we start with, why are you rethinking the annual exam?
Well, there's a lot of publicity, as you said, from Choosing Wisely and other sources that say, don't do an annual exam. And people are, frankly, confused about this. When you dig beneath the surface, what they really say is, don't do unnecessary visits. Don't do unnecessary tests. Don't tell people that they need to come in if they're feeling well, if they don't otherwise want to. But they also say, have a relationship with a primary doctor and see that person when you do have symptoms. And so I think what people may hear is, don't come in at all, or don't come in for on a periodic basis. But it really depends on what your particular needs are.
And I assume, though, that you would have let's say that you're a relatively healthy adult. You really don't have any problems. Shouldn't you at some point come in for a baseline exam? When should an adult do that? And what tests should be performed when they do it?
Well, the key to living long and living well is a healthy lifestyle. It's not necessarily having tests. We overestimate the value of the testing, and we underestimate the value of the healthy lifestyle. The guidelines would suggest that men somewhere around age 30 should have their cholesterol checked. Women should have their cholesterol checked somewhere around the age of 40. Women should have the usual preventive services. But as far as other testing, other blood tests, there's very few things that really have any particular value or will help us live better or live longer.
So are you suggesting that for a man, I really don't need to come in until I'm 30 if I'm feeling well and have basically no symptoms?
You need to get your blood pressure checked somewhere, somehow. You need to get your annual flu shot, and you need to get other immunizations on a prescribed schedule. You need to be sure that you're eating right and eating healthy. You need to get regular exercise. You need to get help if you.
I know, but when do I need to come see you? A healthy male, first time.
You need to come and see me if that's the only way that you can achieve these other things.
Well, I can't get vaccinations, can I? Well, without coming to see you?
You could get them at the drugstore.
Oh, okay. Well, I'd rather come see you.
I would be happy to see you.
Yeah.
I would be happy to see you.
And then for a female, other than the routine gynecologic examinations and pap smear, which is what now, every 3 years or something, not every year, they ought to come in at 40?
They should come in. But I wouldn't separate those routine gynecologic examinations from, quote unquote, coming in. They need to come in for those. But they wouldn't make a special or separate trip outside of those kinds of activities. So if you are coming in for a pap smear every 3 years, come in every 3 years.
Choosing wisely as a recommendation or as a way of your medical career, medical care using choosing wisely kind of butts up against screenings. It doesn't seem like those two things would go in the same conversation.
Well, I think they do. I think that there are screenings that have been proven to be effective. They may not be as effective as we think they are, And again, healthy lifestyle is much more effective than going through the effort of screening, but it has its role and should be done. But it probably doesn't need to be done any more often than what's recommended.
So if you come in for a physical exam and you do whatever tests you think are appropriate, that's when you would tell the individual, male or female, as long as you're feeling well, I don't need to see you again for blank years. Right?
Exactly. But the problem is that what people hear, what all of us hear, is don't come in. We only hear that part of the message. The other part of the message is there's lots of things that need to be done. For instance, there's been recent things in the newspaper and in the media about women don't need pelvic examinations. They do, in fact, need pap smears. They do, in fact, need testing for sexually transmitted illnesses. And for many women and many individuals, they conflate those things into one thing, and all they hear is, don't come in, don't do this. And so it's do the right things on the right schedule.
So where did the idea then of an annual exam or a yearly physical come from?
That goes back over a century, and it's no wonder that people believe that this is something that's important and the key to good health. Well over 100 years ago, the public health community was preaching this. They were trying to find syphilis and tuberculosis and rheumatic heart disease, and they were appalled by the number of men that were rejected for military service in World War I and World War II. And the organized medicine was preaching this. But it wasn't until about 50 years ago, when everybody got insurance, that the patients actually came on board. Unfortunately, about the time the patients thought this was a good idea, the medical community started to look at it critically and say, we may not be doing any good, and we may be doing some harm.
It's interesting that I can remember, and you maybe too, maybe not. It was probably 20 years ago, we would get these emails from administration, and they would say, if you haven't had your annual physical examination, please go get it. Remember?
I absolutely
Do you remember that?
remember that.
Yeah.
And many employers to this day believe that coming in for an annual exam is a key to good health. But
not necessarily, huh?
Not necessarily. The key to good health is a healthy lifestyle.
You said that there might be some harm that is created or generated because of this. What did you mean by that?
Well, think back for our listeners, their own experience. Many, many people will have had a test and they get a apparently abnormal result and then have to have further tests to follow up on that. We in the medical community view that as a harm. It's questionable whether or not patients view that as a harm. They may view it as evidence of thoroughness. And so, but anxiety is generated, people get worried, more tests are done, and it may or may not be helpful.
May or may not be the right thing. But lifestyle is the key, though, you said.
Absolutely.
Yep, we've heard that more than once, haven't we, Tracy?
Absolutely.
All right, rethinking the annual exam with Mayo Clinic family physician Dr. John Wilkinson. Interesting topic. Thanks so much for being with us.
Thanks for having me.